ICL is a precise and effective procedure offering a safe solution for correcting high refractive errors. In today's video, you will be watching Dr. Ashwin Agarwal perform a routine phakic ICL surgery, and we will be going through the key steps of this technique.
This is a 19-year-old patient with myopia of minus 17 diopters, anterior chamber depth of 3.02 mm and adequate endothelial cell count, for whom we plan an ICL implantation. So here a side port is made, then using a 2.8 mm keratome, the clear corneal incision is made, followed by creation of a Wong pocket. Adequate viscoelastic is injected into the anterior chamber to protect the corneal endothelium and anterior lens capsule. We will now see the correct technique of loading an ICL. Viscoelastic is injected into the cartridge, making sure that there are no air pockets. The ICL is then placed into the back end of the cartridge using forceps. Orientation is ensured by the hole in the foot plate, which should be at the leading right end. We can see that the ICL has 3 holes, 1 in the optic and 2 in the perioptic zone. Using coaxial forceps, grasp the ICL near the first hole to prevent slippage. Withdraw in one continuous gentle motion, ensuring that the 3 holes are in a straight line, which confirms that the ICL is not twisted. Also make sure that there are no air pockets. The ICL is then gently injected into the anterior chamber, anterior and parallel to the iris plane, all the while making sure that the orientation of the ICL is maintained by the 3 holes being in a single straight line. The haptic foot plates are then positioned under the iris one by one gently using wire rod. Make sure not to touch the cornea or the natural crystalline lens at any point during the procedure. The viscoelastic is removed completely to prevent postoperative IOP spike. Hydration of the Wong pocket is done first, followed by hydration of the main incision. Miotic is instilled at the end of the procedure. The lens vault and IOP should be checked within a few hours of the procedure and then the next day.